If you're watching this video on the NES YouTube channel, there's more information and useful links in the description below.
Hello and welcome. My name's Eleanor Lochrie and my colleague Jen and I are here today from Knowledge Services to talk to you about health literacy and the tools and techniques you can use to communicate more effectively with patients and clients. So we do want this to be an interactive session, so please be prepared to participate in some polls and quizzes. You can use another browser window or a separate device like a smartphone. We will be using Slido, so if you can please go to slido.com and use the event code HealthLit. You can also use the Teams chat, or there's a Q&A that's attached to the event code on Slido. We will be monitoring this Q&A for the next week or so, so you can post questions in from now. But also if anything occurs to you over the next week, please feel free to post your questions in, and we will pick these up. So starting off with the first question of what our learning outcomes are for today. This session will cover what health literacy is and why it's important, tools and techniques you can use to support people with their health literacy, where to go for some trusted health information, and simple questions that you can ask, whether it's health information or not, about how you can judge the trustworthiness of resources. And we'll also have some further resources at the end if you want to read more and find out a bit more about health literacy. So what is health literacy? Health literacy is people having enough knowledge, understanding, skills and confidence to use health information to be active partners in their care and to navigate health and social care systems. And what is the impact of poor health literacy? Well, the impact of poor health literacy is that we're more likely to experience poor health outcomes. So wait until we're sicker before we go to the doctor. We may misinterpret messages regarding health and healthy behaviours. We may find it harder to access the right services and be less skilled in navigating the healthcare system. Those with long-term conditions who have health literacy issues are at greater risk because they have more to manage. They are less likely to manage prescribed treatment, more likely to be hospitalised with longer stays in hospital, and higher rate of admission to emergency services. If you're less able to communicate with health staff, you'll be less involved in shared decision making. So whose responsibility is health literacy? So health literacy relates to a range of communications, including written, spoken and visual. All health and social care staff in Scotland have a responsibility to support health literacy. We do have this very useful fact that we like to share, which is that when presented with health information, half of what a person is told is forgotten and half of what they remember is misunderstood. So I think that's quite a striking fact, and something that we're all aware of if we're sitting in a doctor's surgery or at a hospital appointment, how difficult it is to retain information. So we've got a handy infographic. This is taken from the Patient Information Forum website. And if I just read off some of these stats to you, 1 million cannot follow a letter from a GP surgery or hospital department. 5 million adults cannot find relevant data in standard health information. 1.7 million are unable to explain symptoms and feelings over the phone. And 6.5 million cannot measure or record height and weight in a chart. And this final figure, 9 million people, are unable to use digital tools that are needed. So I think that gives an idea of the scale of the problem. So what we want you to do now is think about one word which represents how you or the people you support feel when being presented with health information. So Jen's going to post the link in the chat for the Slido, or if you go to slido.com and put in HealthLit, receiving any kind of medical information can make you feel anxious or nervous, and this can have an impact on a person's ability to absorb and retain information. And I think we can see by the words that are being added to the word cloud here that everybody understands that: bamboozled, confused, panicky, stressed. Fantastic. So I think we can see everybody understands the consequences when you are feeling confused and bamboozled and overwhelmed, and how much more difficult it can be then under these circumstances to take in new information. Okay, let me just give a few extra minutes so that we can get some of these responses in. Yep, absolutely foolish, pressured, upset. Okay. And they're still coming in. Okay, fantastic, guys. Thank you very much for that. And now we've also got a question for you. So if you stay on that same link on Slido, you should see you're being asked a quick question. The impact of poor health literacy is... and as you can see, all of the above. So poor health outcomes, harder to access the right services, difficulty in self-managing long-term conditions, and less able to communicate with staff. Okay, thanks for that, folks. So it is the best approach is to take a universal precautions approach and assume that everyone can be at risk. Never assume that somebody's not at risk of health literacy when, regardless of their education, their language, their culture, their age, it can affect anybody under any circumstances. So we do have some health literacy tools. These are simple techniques that you can use which can help you communicate more effectively when sharing health information. So more information about these can be found on the Health Literacy Place website. We'll post the link to this in the chat. So if we just start with the first of these, which is your teach back. So you cannot tell if a person has understood you just by looking at them or by asking them. Regardless of a patient's health literacy level, staff must ensure that people do understand the information they are being given. And remember, we've said that roughly 50% of information provided to patients is forgotten. And of that 50% that is remembered, nearly half of that is incorrect or misunderstood. So if you can get people to teach back what has been discussed or what instruction has been given, ask patients to state in their own words what is being discussed. One thing to say is that it should be clear that you're confirming that you've explained things in an appropriate manner and that your patients or clients are able to understand you. So it's not a test of the patient's knowledge, it's a test of how well you've explained things. And using patient leaflets, etc., to support understanding is always good practice. So teach back is appropriate for use with all patient contact, and you should plan your approach. Think about how you will ask people to teach back. So there are some approaches you might take. So you might say, I would like to check that I've explained things properly. Would you mind telling me what it is we've discussed and what I've asked you to do? What you definitely don't want to do is ask, have you understood everything we've discussed? Because that's when you have the situation where people just nod, regardless of whether they've understood the information or not. So the next health literacy technique that we're going to talk about is chunk and check. This should be used alongside teach back. Break information down into small pieces or chunks and check for understanding after each piece before moving on. What you want to do is avoid information overload and give people time to absorb information and ask questions. So if you think about your day-to-day practice and the terms and the acronyms and words that you routinely use, these can cause a lot of confusion. It can be challenging for people to understand, and we should, where possible, use plain and simple language to explain things. So using simple language is a very simple health literacy technique that you can use when you're discussing things with your patients or clients. You can also use pictures. Pictures can help improve understanding when communicating new information. Images should be used in addition to, not instead of written or spoken information. They should be used to support discussion and encourage questions. So as well as improving understanding, pictures can also help people recall information. Again, routinely offer help with paperwork. You cannot assume who might need help with paperwork and forms, etc. So offer everyone help in a friendly, non-stigmatising way. You might say something like, please let me know if there's anything on the form that isn't clear, and I'll be happy to go over it with you. Okay, so folks, if we go back to Slido, again, Jen will post the link in the chat for this. You should see a set of 3 questions about the best terminology to use. Okay, so if you fill in these details and submit, we should start seeing these results coming through. Excellent, we'll just give everybody a chance to submit their results. I can see most of you have went with bad, which sounds like definitely the best word to use when talking with patients to me. Okay. Yep, you've all recognised high blood pressure as being the simpler phrase to use. And then finally, last question we've been asked here is blood sugar. And again, I think everybody's recognised that that's more recognisable than blood glucose. So one more quick question on Slido. If you break information down into bite-sized pieces to help people understand, this is called. And everybody's got that as chunking check. Okay, well done, folks. Okay, so what we have here is a quick recommendation for some sources of information to share with patients and clients. This would include things like NHS Inform. This is a really excellent source of information that you can signpost patients towards. Public libraries are also a really good source of health information if you want to refer your patients to find trustworthy sources. And you also have a lot of third sector websites out there as well, which provide good quality information, which is designed to inform patients. So if we jump back to Slido, got a choice here of what you think the most reliable source to share information with a patient would be. If you're sharing information about high blood pressure, which of these sources would you pick? And everybody chose NHS Inform. Perfect. Okay, so thank you for that. So we're now going to move on and we're going to look briefly at the wider question of information literacy. When you find information, whether it be health information or any other kind of information, how do you know that it's trustworthy? Assessing information and evidence can be tricky. When we need to assess the trustworthiness of a source, particularly in the case of research or evidence, part of figuring this out is often called critical thinking. This is a really important skill for your professional development, but it's also really useful for everyday questions. A good starting point is to use the 3 W's, so what, who, and when. So this is an approach that you can apply even just to websites that you come across to help you gauge whether you can trust the source. Often you'll have an instinctive feeling about a website. You'll think this looks totally dodgy, but why is it you feel that way? And is the information actually trustworthy or not? So what we're going to do in a moment is provide you with 3 links to review, and we'll give you 3 minutes to look over these. These links are to 3 different sources, and we would like you to try applying this what, when, who approach to assess whether the information is trustworthy and what you think of the site. So you'll have 3 minutes to reflect, and then we'll ask you all to give your opinions. We're going to ask you to give each link a colour, so red, amber or green, and post this in the chat. So if it's totally rubbish, you'd give it a red. If it's okay but not brilliant, you would give it an amber. And if you think it's a really trustworthy and useful source, you would give it a green. So before that, I'm going to run through this approach. So the first of these things on the list is the what. So relevancy, does it actually help answer your question? Validity, are the arguments logical? Has the author given any evidence to support them? Accuracy, is the evidence used to support the arguments actually relevant and correct? So if there are links in the article you're reading, are these to reputable looking articles? And when you read these articles, do they actually support the argument? Because it is possible that someone has linked to reputable, trustworthy sources, but these actually don't support the arguments of the original article. You should also think about bias. Is the author giving both sides of the argument, or are they trying to force a viewpoint upon you? And coming back to evidence again, how was it collected? Are there references you can check? You might want to take the time to look at these yourself instead of relying on the interpretation of others. So our next thing is who. So about the author, who actually wrote the information. Can you find an about page which details who's responsible for keeping it up to date? What are the person's qualifications? Are they knowledgeable enough to actually provide the information? You can try to Google them or put them into a database to see if they've written anything official. You can try to find out a bit about their educational and professional background. And what's the aim of the website? Does it represent a particular organisation with particular motives or agendas? Is it trying to sell a product? Look for advertising. Requests for subscriptions if you want to read more are usually a bit of a clue as well. Is it a formal or a personal resource? Is it a blog? Is it a social media site? So, and consider how that might affect the reliability. It's really easy for anybody to publish material, even books and articles on the web these days, without having it properly checked by an editorial process. So have a look out for logos or, again, information on the About page. If it's been reviewed, who was it reviewed by and how well? And again, looking for references to trustworthy sources, policy documents, legislation, and those types of things. Okay. And then finally, we have the last bit we have here is your when. On the internet, there's no obligation for information to be revised or updated at any point. So it is worthwhile considering how up to date the information is. Can you find a date that it was created? Is it clear? Can you tell when it was last updated? A good tip to see when it was last updated is to scroll to the bottom of a website and look for the copyright symbol, so that small letter C. and it usually tells you the last year that they put the copyright on it. Also, using your own knowledge of the field, is the information still useful or has it been superseded? Even if it was written really recently, it might not be correct. Alternatively, even if it was written a long time ago, it might still be the most up-to-date in that particular field and the best available knowledge. And then finally, you can also look at the URL of a web page. This can tell you things about the site that you're on. So in this example, you can see that it's a government website. You can see with this Strathclyde Uni web address that it's an academic institution. And you can also see about the location of websites here. You can also tell things like, is it an organisation, or is it a commercial company with your .co.uk, for example. Okay, so we're at that point where we're going to ask you to have a look at the links. Jen's going to post these in the chat for you. The first link is to video. You don't need to watch the video. We want you to look at the information about the video. How old is it? Who's produced the video? Can you find anything out about them? Can you see any indication of a motive or agenda? There's another couple of links there. Again, we're looking for information that you can gather looking at the web page about who the author is, who's produced it, how reliable you think it is, and how up to date you think it is. We're going to give you 3 minutes on the timer, and that's 3 minutes for you to reflect. And at the end of that 3 minutes, we'll ask you to put in your opinion of these 3 separate links. Okay, that's 2 minutes to go, folks. You might want to start looking at the second link if you haven't done that yet. And that's you down to 1 minute. So you might want to look at that last link if you haven't started already. Okay, and that's us. Okay, so now 30 seconds to reflect, and then we want you to give us, what do you think of that first video, the one about applying a tuba grip to a leg? Are you going to give that a red, an amber, or a green? Just hold, don't start posting in the chat yet. Give it 30 seconds. Oh, I see you've already started posting. Okay. Okay, I see lots of you have already posted in for the second link. Okay, so let's move on. For anybody who hasn't posted in for the second NHS Inform link, what colour would you give that? Perfect, absolutely. So we would expect the NHS Inform to provide you with the most reliable information. And then you've got the final link that we were talking about, your essential oils and your ADHD. What kind of colour would you call that? Would you give that? Definitely, absolutely. Okay, brilliant, folks. That's well done to everybody. Fantastic. Okay, that's excellent. Okay, so well done, everybody, and thank you for that. I just have a few bits of resources to share with you before I finish up. If you're interested in learning more about health literacy, there are some health literacy e-learnings that you can do. There is one on Turas Learn. There's also a Public Health Scotland e-learning, which is focused in the link between health literacy and health inequalities. Jen did put the link for the health literacy place into the chat earlier, but this is a really good source of information if you do want to know more about health literacy. You can also keep up to date with us in Knowledge Services. You can sign up for our newsletter. You can follow us on Twitter. And if you do have any questions, you can contact the NES Knowledge Services Help Desk. Hopefully that was interesting for you today. Okay, I believe, Leslie, that you'll make the PowerPoint presentation available after the session and that there will be a recording of this.
Yeah, we'll make sure the presentation slides are added to the events website under the resources tab, and we have been recording today. We will edit the recording and make that available on the NES YouTube channel in due course.
Perfect. Okay, thank you very much for that, Leslie, and thank you for coming, folks.